Hello, I'm Black Bright. I'm not quite sure how many of you saw my first video about blacks dying disproportionately from COVID-19. I had quite a few thoughts about it, so I had to break it up into two parts. I'm sure there's going to be an overlap. It was inspired by David Harewood's documentary, I think it was on BBC One, about why BAMEs or blacks are dying disproportionately. So I had some thoughts, and so I'm going to share them with you. This is not a news channel. It's called Black Bright News because I like to bring out the brighter side of news in the sense that I'm informing, shining a kind of a light. I do talk about the news, but it's basically my opinion, so it's not factual. And yes, if you want to put your thumbs up, you can. If you don't like what I talk about, you'll know soon enough, so you can put the thumbs down. You can share with your comrades. I'm finding that sharing is very important these days because YouTube has just got so many influencers where for some reason it's not being shared in a way that it used to be shared. So if you want to share it, that's great. And if you want to subscribe, that's even better. So I'm going to read from my notes, and like I said, it was inspired by David Harewood. The real reason I put here why blacks are dying from COVID-19. Now, of course, it's not the real reason. Nobody knows the real reason. It's still being researched. So I am just putting my 2 pence worth in. I've called it Novo Racism Updated. Packaged differently, same effect. I.e. Novo Racism is new racism. It's like, you know, when you get, it's very similar to, you know, the old phone. The old Nokia was big, still a phone, but the new shiny one, it's got so much more in it, but it's much more sophisticated. It's not so overt. All its technical advances are not obvious, but you know it's easier to use than one of those old antiquated phones. So racism, from my premise, is similar. You know, the old racism, hanging people from trees, lynching them, splitting them from side to side, brutalizing them, whipping them with chains. It's not like that now. Now it's much more subtle and much more sophisticated, and it's barely noticeable. The only way it's noticeable are by those who feel it. They feel it in their bones, and that is very, very hard to articulate. It's hard to evidence. It's hard to prove. So, the figures in America with regard to the deaths is 1 in 555 Black Americans died of a coronavirus-related disease. 1 in 565 Pacific Islanders died of the coronavirus-related disease. And then you have 1 in 665 white Americans who died of the coronavirus-related disease. So it's not that much. It's not that much. It's not disproportionate. Well, I guess it's disproportionate when you think about how small the population of Black and Pacific Islanders are and the number of deaths. So yes, I guess proportionately it's still very high. According to the Office of National Statistics, that's www.ons.gov.uk in England and Wales, males of Black African, Black Caribbean and Bangladeshi ethnic background had the highest rate of death involving COVID-19. Bangladeshi apparently have higher risk of COVID deaths than Pakistanis. Males of Black African ethnic background had a rate of death 2.7 times higher than those of a white ethnic background. What is blamed for the deaths? Comorbidities, pre-existing health conditions, poor eating habits. Those are the main ones that are cited as the reason for deaths. What's causing mental illnesses? That's also cited as one of the contributory factors. Racism, discrimination, disappointment, embarrassment. They all cause anxiety. putting too much pressure on yourself, that can cause mental illness. So those are contributory factors. On top of that, you've got, if you've lost your job, you've got this coronavirus, what's going on, you've got being separated from your family, you've got can't go out. So all of those compound the situation. But going back to the type of people Black Caribbeans are, and like I said in my previous video, I talk about Caribbeans because my background is Caribbean. I'm born in the UK, but my background is Caribbean. So I don't know about the Black African experience. I don't know about the Black Asian experience, but the Black Caribbean experience is very similar. So I've chosen just to concentrate on that. So the Black Caribbean group, very ambitious group. They were quite well off. When they left their country, they didn't come over to the UK without nothing. They came over here with money. They wouldn't even be able to come here if they didn't have money. So the people who came over to the UK on the Windrush were Black middle class in their respective countries or islands. And like I said, they planned to save and return. They would sell. Some of them sold what they had, whether it was a donkey, whether it was a cow, whether it was a piece of land. They sold what they could to come over here so that they'd have a little dosh to start off with. And they did all of that based on a promise. The streets, I mean, I know that was their perception, that the streets were paved with gold. When you think about England, you do think of this Victorian, rich, you know, when you see those old films, those period films, grandiose. And so you had a lot of people expecting to come into an England like that, an England of grandiosity. So they sold what they had and came here with a promise. And of course, their dreams all went up in smoke. They left everything in the Caribbean. And then you might say, so why did they leave the Caribbean if it's so wonderful? But yes, you have the beauty of the Caribbean. You have the heat, the hot weather. You have the sand. You have the beaches. You have the fruits. You have the palm trees. You have the fish. You can go and pick up fish. You have chickens in your backyard. But remember, the colonialists destroyed the structure of the islands, so there was no structure. So those who left, it was because there was no structure, and they felt that they could find a better structure. Well, as far as they were concerned, they were coming to a country that had structure, and that was what was missing. So, like I said, whether they went to England or America, they didn't bargain on low wages. They didn't bargain on being home helps and almost like servants, because that's what it was like. I remember when I went to America, I don't know how many times I've told this story. It might be the first for you if it's the first time you're listening, but when I went to live in America, before I got a job with the UN, I was told that I would have to work as a home help. I'm not saying a home help is below me, but that's not what I envisaged. Anyway, my sister took me around to these mansions, called the mansions, in a place called Great Neck, which is in Long Island. Rich people were living there, massive houses. And I remember going to one of the houses, and they had mirrors from the floor to the ceiling, all the way across the walls. And I said to the lady, how is anybody supposed to clean those mirrors? And she said, you get up on a ladder. So in my head, I'm thinking, not me, love. Then she took me into the room, which was my room. Now upstairs, it was like upstairs, downstairs. Because upstairs, it was marble, pillars, absolutely lavish and beautiful. And where I would be living was one little room with this little broken down dressing table, a black and white TV. And if I wanted to walk around, she said I could walk around in the basement. And I thought, nah, this ain't happening. I said to my sister, she said, oh, you know, this is what we've all done. We all have to do it. And I said, no, it's not for me. And like I said, it's not because I felt I was above it. It's just because I knew that that was not my destiny. And it turned out it wasn't my destiny, thank God. I can't imagine. I prefer to come back here than to do all of that stuff. Anyway, what I was saying is that when the Caribbeans came over here, they didn't expect to have to do menial work because they were professionals. They were professional tailors, professional seamen, professional railway drivers. They were professionals. So when they came over here and then they realised that they couldn't get those jobs that they were trained in, of course it made them feel disappointed and resentful. So England, America was a new start, but they didn't bargain for the low wages, high taxes, sharing room and all that kind of stuff. Too embarrassed to go back. Pretended that they were having a good time, like I've said. What else have I got here? Theconversation.com, this is www.theconversation.com, states black patients were 30% and Asian patients were 49% more likely to die within 30 days of hospital admission compared to white patients of similar age and health. Now, why do I raise that? Because you have to ask yourself, why is that? Black patients were 80% and Asian patients were 54% more likely to be admitted into intensive care and need invasive mechanical ventilation. And that's also according to the www.theconversation.com. I can't help wondering if they hadn't been hospitalised, whether they'd still be alive. According to the BMJ, there's somebody called Mr. Razai, and he is an academic clinical fellow in primary care. And he says, cultural and structural racism adversely affects health outcomes. So, we all know, well, we've been told recently, black women are 5 times more likely to die during childbirth. Why is that? Because like the black men I was talking about in my other video, black women are also perceived as strong, able to tolerate pain, making too much fuss, making too much noise, too aggressive. So a lot of the times they're ignored. So their screams are seen as an exaggeration. So they're turned away and told to come back later. And we all heard about that case where I think they're suing them now, where this lady was told to go back when she was 10 centimeters dilated. No, when she was, I think, 1 centimeter dilated. And then when she came back, she was screaming. She was 9 centimeters dilated, couldn't get the baby out, gave her an emergency cesarean, and she died. You know, and it's, I don't know how health professionals can deduce whether or not somebody is exaggerating unless they have a perception of what genuine pain sounds like. Pain, people with different pain thresholds are going to react differently to pain. So unless you are going to base it on your own pain threshold, how are you going to know whether somebody who's screaming in pain is in real agony or whether they're exaggerating? I'm not sure what the answer is. So what has that got to do with COVID? Similar to my earlier video, the concept that black people can tolerate more pain and are therefore left to their own devices to suffer more pain until they die, which is why most black men are afraid to go to hospital, especially since COVID, afraid they will not come out alive. If they do decide to go to hospital, they tend to wait until the last minute when it's sometimes too late. racism, worrying whether or not racism, implicit bias, will have a role in healthcare could cause depression, anxiety, and mental illness. So what I mean by that is that those who do decide to admit themselves into hospital, they will be worried and concerned about if there is any racists on the staff who people don't know about and might just happen to be allocated to them. These are fears that are not obvious, that are not spoken of. These are fears that people just think of and feel, and do not feel justified in talking about, because people will say, oh, don't be so stupid. Don't be so ridiculous. You're in a hospital. Of course they're going to treat you the same. It's just like those people who say, don't be so ridiculous. The police, they're not targeting you. You're bloody paranoid. You've got a chip on your shoulder. You know, when you're scared, or if you're looking over your shoulder, or when a police car passes you, you get a bit nervous. They say you're overreacting, but they can't feel what you're feeling. They haven't lived your experience, so they can't know. So you can't blame them for not understanding why you might be a bit hesitant. So like I said, the myth of the strong black man causes chronic stress, and stress erodes the immune system. And like I said in my previous video, there is something called weathering, which is where black men have prolonged exposure to difficulties and it slowly breaks them down. They try to deal with difficult situations and survive constant hardships, and they try to do that without too much fuss, but it takes its toll in a variety of ways. Due to unconscious bias, some health professionals do not see blacks as an emergency. They believe they can ride it out because they're stronger. And like I said, that's all perceptions. Headline in iNews, when referring to David Harewood's documentary, stated, black people are 3 times more likely to die from COVID, which was inaccurate. It should have read, black and minority ethnics are 3 times more likely to die of COVID. But oh no, they stick blacks up there, sensationalizing it. And the funny thing is that blacks have the lowest ratio out of South Asians and other ethnic minorities of COVID-related deaths. That's the joke. No, it's not a joke, but that's the reality. And I remember in America, I remember reading that they chose who to give the ventilator to. You had to be worthy of that ventilator. If they considered you worthy, you would get the ventilator. If they considered you not worthy, you wouldn't get the ventilator. I don't know whose perception they were going by. So just because black people suffer in silence, it does not mean that they can tolerate more pain. More black people are aware of racism and therefore unsure if their practitioner is going to be racist. They become afraid to trust their lives to outsiders. How can 21% of the NHS workforce account for 63% of deaths of black and ethnic minorities? You have to think about war. Who was in the front line? Think about slavery. The blacks were not treated as humans. So if you are considered, if you're not as qualified, you are going to be on the front line. People who, the higher you qualified you are, the less hands-on you are. That's a fact. So most people who go for these jobs are the equivalent to manual workers, although they're not manual workers because they are providing a healthcare service. But it does mean that they are hands-on. They are in close proximity to those people who have the coronavirus. And therefore, because they're on the front line, they're more likely to die first. Same way like in war. Those people they put in front, they're more likely to go first. So most of those NHS staff who died were in high-risk frontline occupations. It could be blamed on culturally insensitive services, implicit bias, unconscious bias, cultural ignorance, or it could be stereotyping. We do not know. A lot of this bias is unconscious. People don't realise it exists. You know, oh, I like you, you know, I ain't got a problem with black people. I really like you. You can come over to my house anytime. I got lots of black friends. And they actually believe that they can't be racist because they say those words. But they don't realise it goes beyond that. And it's very difficult for a non-black person to understand what it is to be black. I mean, how can you? I can't imagine what it's like to be white. I just couldn't imagine it. If I could be white for a day, how would that be different? I guess, if I was to be honest, I live in an area which is not too great. When I say not too great, you know, you've got the BNP down the road. And I guess if I was white, I would walk I'd walk in a route where the houses do have those red and white flags hanging out the window. I wouldn't be afraid to walk in that vicinity. Whereas as a black person, I am hesitant about walking in that vicinity. I just avoid it and I just go in the open area and I walk where I feel safe. So that probably would be a difference. Things like that would probably make a difference to me. Because, yeah, when you know that there are racists who don't hide it, then that is when your blackness is accentuated and you know how you feel as a black person is highlighted. So black people are different shades and different cultures. We all act, react, respond and behave differently. African, Caribbean, South Asian, East Asian, but we're all put under one umbrella for the purposes of the census or COVID deaths. Yet the proportions of deaths of black people is a lot lower than the deaths of South Asians, but we don't hear that a lot. We just hear blacks dying from coronavirus, or with black and minority ethnics. People, when they think of black and minority ethnics, they just think of black people. They don't think of the proportions of blacks and minority ethnics. Nobody says that, okay, the proportion, blacks are only 4%, Asians are 11%, blacks are 4%, Bangladeshis are 12%. Well, I had some figures somewhere. But anyway, all I'm saying is that nobody kind of breaks down those ethnicities within the black and minority ethnics to give a realistic picture. So we have to ask ourselves, why does the media not make it clear who is actually dying the most from what, and why is it that there is such a high proportion that die in hospitals? And I think that is all I'm going to say for now. I hope it was interesting. And like I said, you can subscribe, you can share. I know it went on a bit long. Bloody hell, 23 minutes. Sorry, folks. Bye-bye.